Hello, everyone. My name is Mark Gilbert. I'm the Medical Director of Clinical Prevention Services at the BC Centre for Disease Control. And I'm going to be talking today about a study which we did late last summer called on accessing needed sexual health services during the initial phases of the COVID-19 pandemic in British Columbia. So I'll take you back to when we did this survey. It was at the end of July, early August of 2020. And so just to put this in context of where things are at with the COVID pandemic in British Columbia, this graph shows COVID-19 cases in BC in 2020. You can see that this survey took place really after the first wave of COVID in BC, which sort of started in March when the provincial emergency was declared and some of the public health measures were put in place. And after a summer where the COVID cases had been lower, and some of these public health measures were reopened and lifted, and this was leading up then into our second wave in the fall. At this time, we did see decreases in STI testing and diagnoses after March of 2020, quite pronounced. And so evidently in response to the pandemic. And we could think of a number of possible reasons for this in relation to potentially changes in behavior, meaning some of these tests weren't needed, but also other factors such as closure of sexual health services. So that happened in many places in BC as in other jurisdictions. For example, shown here on the graph when our provincial STI clinic was closed and there were restrictions on access to service, which then reopened later in the summer. So the goal of this study was really to understand how the COVID-19 pandemic affected access to sexual health services. We had a couple of specific aims. First was to really understand the characteristics of clients who did not access needed sexual health services during the pandemic, so that who had unmet sexual health needs. And in this study, we focused on our existing sexual health service clients, so folks who had been engaged in services prior to the pandemic. We also wanted to assess the relationship between potential pandemic-related reasons for avoiding care on having unmet sexual health needs. For example, closure of sexual health services, and was that a factor? Our methods for this is that we conducted a survey, which we called the Sex in the Time of COVID-19, which I thought was a very creative survey title at the time. And I know many other people had the same idea, so can't really claim much ingenuity there. But we recruited our clients from the provincial STI clinic, here housed at BC CDC, as well as clients of Get Checked Online. Get Checked Online is BC's internet-based testing service, offers testing for chlamydia, gonorrhea, HIV, syphilis, and hepatitis C. So while our provincial STI clinic is based in BC and largely serves the Lower Mainland, Get Checked On clients, Get Checked Online is available in a number of communities across BC, including on the interior of the province and on the island and in Fraser Health, so is a bit of a broader geographic reach. And these were all clients who had previously consented to be contacted for research by email. So our inclusion criteria were that they needed to be clients who had accessed one of these services in the year prior to the pandemic, and that's who we sent the email invitation to. They needed to be over 16 years of age and able to complete an English language survey. As mentioned, our survey was done at the end of July, early August. And for this analysis, we were restricted to the participants who reported that they needed to get an STI test or sexual health service since March of 2020. And our primary outcome were those who said that they didn't access that service, so they had an unmet sexual health need. Our primary method of analysis was logistic regression, and ethics approval was obtained from the University of British Columbia. So our results, we sent out just over 4,000 email invitations, had about a 36% of folks who started the survey and 28% who completed the survey. We only focused on completed surveys because the majority of people completing the survey didn't, the attrition was fairly rapid early on in the survey. And so for this analysis, the questions were not completed. Of those who completed the survey, about 60% reported that they needed an STI test or another sexual health service since March of 2020, and that became our study sample. Of those, just over half had unmet sexual health needs. In terms of the characteristics of who we worked with, of who answered the survey, our median age was 32 years, and we can see these pie charts just show some other key sociodemographics. On the left, gender identity, so an even proportion of participants identifying as men and women, and 5% as non-binary, gender fluid, or other. About 3/4 of our sample identified as white, 4% Indigenous, and 23% as another racialized minority. And in terms of gender and gender of sex partners, Shown in the graph on the right here, we had about 49% of our sample were people who reported sex with opposite gender partners only. So a fairly heterogeneous mix. So next we wanted to look at the characteristics of the individuals who had an unmet sexual health need. So here we're just showing, I'll just focus on the significant results of our bivariate logistic regression. So we can see that participants identifying as a woman were more likely to report an unmet sexual health need compared to men. In terms of gender of sex partners, men who have sex with men only were less likely to report an unmet sexual health need. And then by type of service, there were certainly some different types of service needs that were associated with unmet sexual health needs. So for example, we found that participants who reported that their need was to get tested according to their usual testing routine were more likely to report an unmet sexual health need, suggesting they were deferring this sort of non-urgent care. And then on the flip side, we saw participants who identified needing to access birth control, HIV pre-exposure prophylaxis, and treatment for a new STI were less likely to have an unmet sexual health need. Finally, not surprisingly, individuals who said that they were comfortable accessing in-person sexual health services during the pandemic were much less likely to have an unmet sexual health need. And Get Checked Online users, who were sort of the majority of our sample, were ultimately less likely to report having an unmet sexual health need, suggesting a role for digital interventions. We then looked at some of the possible reasons for avoiding or delaying self-care and looked at their relationship to having an unmet sexual health service need. Overall, in the sample, as you can see in the first column with the rectangle around it, the most common reasons reported were public messaging that they weren't supposed to seek non-urgent healthcare by 35%, concern about getting COVID-19 at a clinic or a lab, 32%, and that the place that people usually go for testing or care was closed or had reduced services. We were worried in this survey because at that time there had been some emerging reports around stigma associated with having sex during the pandemic. So we did include in our survey some questions related to perceived stigma. And here you can see that 12% of participants agreed that they were worried that their healthcare provider would judge them for having sex during COVID as a reason for avoiding or delaying care. Unsurprisingly, all of these in our unadjusted logistic regression were associated with having an unmet sexual health need, and this relationship was still strong and persisted despite after adjusting for some of the other factors that we know were associated with having an unmet sexual health need. So in conclusion, over half of our existing sexual health service clients in our survey didn't access the needed sexual health services that they had during the initial months of the COVID-19 pandemic. The results suggest that the urgency of need was likely an important factor. So, for example, being less likely to have an unmet sexual health need if they needed STI treatment, which would be more urgent, more likely if they needed to get routine testing, suggesting that they might be deferring routine testing. And this is something that's been shown in other studies in other jurisdictions as well. The most common reasons for reporting or avoiding delaying care were public messaging, concern about acquiring COVID-19, and service closure and reduction. But there are certainly other factors of concern, including the potential for stigma. And this was sort of last July and sort of really trying to understand what impact that may still be having or could be happening now. We've certainly seen many places, including here in BC, sort of switched to try to do more sex positive, like harm reduction messaging related to sex and COVID, but still stigma is likely a big barrier for folks. The finding around Get Checked Online users being less likely to report unmet sexual health need, I think, just really highlights the role of digital interventions or alternative approaches to service delivery that could help to improve access. And certainly there's a number of I think the pandemic has really triggered a lot of movement on this in terms of, greater use of virtual care, virtual visits for sexual health care, thinking about alternative models. Certainly one of those that were most acceptable to folks in our survey was related, for example, to thinking about how we could do self-collection for specimens at home. And just to note that this was a survey of existing sexual health service clients, so it shouldn't be considered generalizable to a population at large, or even like populations of folks who maybe have sort of underlying risk factors for acquiring STIs, and it may also be BC dependent. And with that, I will close. I would just like to thank the many members of the research and study team, as well as the thoughtful contributors, thoughtful contributions of many of our community partners and clinical partners who work with us on our community advisory board. Thanks.